Good morning, everyone. Thank you for joining us this morning. So I'm Julie, I'm Vice Chair of Optometry Scotland, and today we booked ahead for the event, and in true pandemic style, we thought we would give you an update of what we've been up to, and then we've obviously come into another lockdown, which in itself has raised quite a number of questions. So we're here today to answer some of the questions. We're obviously here yesterday as well, so some of the questions we've maybe gone through if you were on yesterday morning's presentation. And we're going to go through some more questions that came through the chat yesterday. So we're going to go through some of them as well. So there will be a difference for everyone. So I thought I'll just hand over to other panelists just to go through who everyone is today. I'll pop you on there.
Good morning, folks. I'm Alistair Duff and I'm an independent optometrist and I represent the independents on the board at OS.
Hi everyone, good morning. I'm Frank Monroe. I'm an optometrist independent practitioner in the Glasgow area, Glasgow and Lanarkshire, and I also act as advisor to Optometry Scotland. So looking forward to answering some of your questions and queries this morning.
Sorry, Julie, you're still muted.
Oh, it's 2020 is coming back to haunt me in 2021. So yeah, as we go forward today, then we'll be going through some of your questions that you've asked us already, but you can also just send questions through the chat function and we'll pick them up for you at the end as well. Okay, so I think I'll crack on with the first question. So I think it's something that's kind of come up quite a lot through everyone, but are we still able to send out reminders while we're during this phase?
It's a really good question, Julie, and it's one that, you know, it's getting asked time and time again. The basic answer is that the regulations or the rules at present allow reminders to be sent out. I think everyone is wary of inviting asymptomatic cases into the consult room because of the risk of COVID exposure, and we understand all of that. So it all comes down to a risk management and the judgment call by the practice and the practitioners. There are undoubtedly a lot of patients that are out there that have possibly not been seen for over 2 years. They may be living with an undetected problem, and that would always obviously be an issue. How we unpick that, how can we do that selectively, is a really big challenge for any recall system. There are loads of people out there, of course, with emergency and essential needs, and they should quite rightly be recalled and brought in to practice to be managed. It's the other group of we call routine recalls that maybe we need to deal with in a different way, and I think a lot of practices have adapted their system to maybe looking at telephone call and a bit of triage on the telephone. So if the person really needs to be seen, they really feel they have a problem, the message is we're open and we can see you. Or if you feel you don't need to be seen and it can be deferred to post-COVID, maybe that's the best option for you. I think there's no great answer to this question, but that's probably rounds off most of the key issues.
I think with routine as well, it's something that the reminders going out, it's just as a reminder of the health kind of check itself and that we're actually open. So, you know, some people might be at home with a niggle, but they just don't know that we are actually open. So I think the reminders, they're more an invitation to say, yes, we're still here. But if you've got a good triaging system in place, it's then for the patient to phone up and decide with the practitioner, do you think it's worthwhile coming in kind of at this stage, I guess.
Yeah, I'd agree.
Yep, I totally agree. I think diaries are up and down at the moment. Some days you're full and the next day it's a wee bit quieter, getting a lot of triages. But you're right, the message has to be that we are here for the public, unlike last time where we did EETCs set up in Scotland. So I've got the next question, and it's to yourself, Julie. Can domiciliary services continue?
Yes, so we're still continuing as we were before. You know, the changes, there haven't been any changes come in as such. It's just, you know, heightened, everyone needs to be kind of safe and careful. So just as you are now, we can still see patients, but I think it's essential that people are triaging, you know, doing remote consultations where you can, and looking at the reasons as well. You know, we're operating safely with PPE, so I think it's ultimately up to yourselves and having the discussion with your patient as to whether you think it's worthwhile. Some of these patients have potentially been overdue 6 months, and they could be in high risk groups for other conditions as well. So I think it's careful just to weigh up whether it's worthwhile going in or not. But yes, if you feel the need to go in, yes, you can still go in. Just
and it's the need to make sure that you dawn on the doorstep, and make sure you've got the proper PPE in place and that you've given good advice to patients or carers at the other side. I have a question for both of you. Is there any guidance on testing someone who can't or won't wear a mask?
Yes, the answer is yes. The best place to go is the college FAQ, and it basically says if a patient refuses to wear a face covering, you should consider if there's a reasonable reason for this. So if they have an exemption or a learning difficulty, in these cases, you may wish to see the patient wearing a face covering yourself, although in this case you should adapt the examination, so no handheld instruments going too close. If the patient does not bring a face covering to the practice, you can provide them with one, and young children do not have to wear a face covering, but you could ask them or their guardian if they're able to do so. And I think it less so up here, but it mentions direct ophthalmoscopy. That, again, I said yesterday, I don't know the last time I picked up a direct, but we should be reducing the risk on these checks. But yeah, it's discrimination not to see them, so we need to be able to see them. It's how you deal with it.
I think the important thing to remember as well is we're the ones wearing the fluid resistant masks. I think we've got, as long as you have visors in place and you, like you're saying, Alistair, adapting how you're testing the patient, you know, if you can keep your distance as well. I think there's kind of various sides to that too, but as Alistair says, yeah, in college guidance, we can't refuse to see the patient on those grounds.
Okay.
So I've got a question then. So if you're a practice, if someone's come in saying that they're a practice owner, what do they look? Where do they look for up-to-date advice and guidance?
Well, there are a number of sources. A lot of practices, a lot of businesses will have their own employment law support, where they could naturally turn to that. And that would be my first option in life. There's ACAS, which is out there for everyone that they could dip into. The college guidance is always available to us, and then there's other local NHS board guidance. I work in Glasgow and Clyde and in Lanarkshire, and there's almost a weekly bulletin that comes out from the board which gives practices and practitioners and patients an update. There's COVID updates from Health Protection Scotland and Nest Insurance. I've published lots of information about infection control. I think it's just being vigilant, looking for what's out there and responding to that and absorbing it, taking on board and looking, and particularly with any of the college guidance, to make sure that you look at the Scottish relevant advice and not the UK-wide advice. That's very important. And to the college's credit, they do usually give separate advice notes for each of the 4 countries. But the safest thing is to look at what's happening in your board area, because that information will have come from the Scottish Government.
Yeah, and I think we mentioned yesterday, just a big reminder to everyone to get logged into their NHS email accounts. So many Optoms don't use them, so get logged into that, because that's where you first hear about vaccinations, that's where you first hear about all the things. So get logged in if you this week.
Today, now, not now, maybe later. No, definitely.
Not now. Wait 40 minutes, please. Right. Okay. I've got a question for both of you. How do I know if I'm operating safely, and what should I do if I feel I am not? Another wee tricky one. And it's a question that's mainly from people, employees, I think.
Yeah, I think it depends where you're working. You know, if you're operating, it's hard when you're testing by yourself to keep ahead. And if you're kind of an independent optician or a locum, potentially traveling around to keep up to date. So I think, like you said already, Frank, the college website is brilliant for the frequently asked questions. It's been updated all the time. You know, any of the PCAs coming out, that tells us exactly what we're allowed to do and when we're allowed to do it. So I think Health Protection Scotland, I think you mentioned that already. I think the other thing is if you're working within a larger organisation and there's maybe kind of rules coming down on you and you're working alongside other people and you're trying to balance the kind of being the clinician and running the business as well. So I think, you know, if you feel that you aren't getting support or you're not feeling yeah, you just don't have that support there. I think the best thing to do is reach out to your manager, reach out to a colleague, someone that you can speak to. Do you have a clinical kind of person in the company? Is there clinical services, professional services? That's what they're there for, is to make sure it's been operated safely. And I think as well, our insurers, they're there to help us. And it might be sometimes there's a lot of information coming out. They know, they do it every day. So, FODO, AOP, they can be on hand to give any advice. I think you could just phone them confidentially and ask, and no questions stupid either. You can just contact them and say, what do you think? And they can often mediate or even tell you, actually, this is the guidance, or why don't we speak to your employer this way? So they can provide you the support there. So I think that's probably the best thing to do there.
And if everyone's got an NHS email address, they would get their information from the Scottish Government, Health Protection Scotland, so that they would have that information to hand if they had to raise it with an employer or a colleague.
Yeah.
You anything to add to that, Alice? Ali?
No, I think you guys have covered everything that I would have said. Yeah.
Okay, so I've got a question then. So if a patient is shielding, should we still be seeing them in practice just now?
Yep, so I can answer that one. I think the short answer is yes, we can still see them. Whether we should is a different matter. I think it all depends on the circumstances, and that's why triaging is really important. And it could be that the patient's phoned in, get your staff to triage that, but then the practitioner may wish to triage as well on the telephone and see, is it needed? Do they need to come in? For example, a barn door, flashing lights and floaters has got a high risk of retinal detachment. You want to get these people in, whereas they phone up and they've got a bit of a red eye. Try and do it all over Zoom or iPads, as much virtual as you can. So it's a case of should and could, and use your professional judgment. That's what I would say to most optoms out there, is use your professional opinion and judge it on that one.
Perfect.
Thanks, Alistair.
I've got a next question for Julie. Can I see contact lens patients? And that could be new fits or contact lens checks.
Yeah, I think it's probably similar to the question we just had. You can obviously still see contact lens patients. The GOC and the college have obviously, well, GOC have exchanged, kept the regulations about remote consultations and, when you can prescribe contact lenses as well remotely. And likewise, college have updated their guidance there as well. So yes, we can. There's a lot we can do virtually with a contact lens patient. It's amazing just speaking to them about their vision, comfort, how much information we can actually get. So is there an actual need to bring the patient in? I think with the contact lens patients are quite liking getting the aftercares from their house, I think, on the whole. But if there's a reason to bring them in, then yes, we can bring these patients in. If they've got symptoms or complaints with the lenses, then definitely we should be seeing these in practice. So
yeah, I think we mentioned yesterday.
Yeah, exactly.
We've got balancing the risks and rewards, isn't it? It's and the same basic rules apply to any aspect of care. If the patient's in distress, has an issue, then you can see it, but can we perhaps park it otherwise for another 3 months until we're all vaccinated and safe?
I think when we first started doing it, we put everyone on 3 months recall, and then maybe another month came by and we're in lockdown still, and then another month, you're like, these 3 month recalls are coming up again, and then you put them on 3 months. Thought maybe that was a bit ambitious. So yeah.
I think we mentioned yesterday, there's much less risk with modern contact lenses. That you get so many aftercares, there's nothing wrong with them. So it's good to be able to do it remotely, but you can get them in if you need to. And I think those forms, are they available? Is it the GOC website? The remote?
The college? I think the college.
Was it the college website?
Yeah.
So Google that, get your college, your remote forms to be able to fill that out as you're speaking to them on the phone. Really, really helpful.
Perfect. I've got a question here around safety. So is it safe for a parent to come in for an eye test but bring in 2 children into the test room, bearing in mind obviously children aren't wearing masks?
Yeah, it's another one where you've got to assess the situation. Maybe it could be addressed at the front desk when the person's from the receptionist, when they're booking an appointment in for the child, and that there's maybe several other children or another child associated with it, just to let the mum or dad know that this is, we've got the 2 metre rule, we've got the safe distancing to maintain. And I think by now the vast majority of the public understand those restrictions, and it's very rare now that you'll see the tribe turning up as it would normally happen and come into the practice. So I think most people know, and if not, maybe a wee prompt would help. And bear in mind that children don't need to wear face masks. So if you do have to have them in the room, and if the room is big enough, and I'm looking at Alistair's consultant room there, it's easy enough to manage a 2 metre safe distancing. Someone could be sitting in that wee chair in the corner and you're at least 2.5 metres away from them. So a lot of consultant rooms are big enough to accommodate that. But I think it's a wee bit of common sense and a little bit of good comms and organisation up front would prevent that being an issue.
Yeah, absolutely. I agree with the communication. Get your staff trained to put that across, because let's face it, people don't come for eye tests all the time. We know how an eye examination works. They don't, and they don't know the rules, etc. So communication up front. I think just to add to that, I've recently been keeping the door open. If I've got some patients that they've got to bring their children, maybe say, look, we'll put a wee chair out in the hall, but we'll keep the door open, etc. We're just trying to do as much as we can to increase distance, less contact, etc. But again, some people are single parents and maybe they can't leave their kids with anyone. So it's again, risk versus reward.
Yeah, I think just exactly what you're saying, Alistair. I mean, patients, we are still learning all these new ways of working, and we work in it every day, all day. Patients don't know, what's happening, and they've maybe never been to your practice before. They maybe were in the practice but in a different test room, so they maybe don't know sizes as well. So I think it's the communication's probably kind of key in that scenario.
Absolutely. Just before we move on, can I ask anyone who's watching, if you have any questions, post them up and we'll try and answer them at the end.
Thanks, Alistair. I've got a wee question, and again, based on some announcements that were made by NHS boards last week, is elective surgery still taking place in the hospital eye service? To both of you, please.
I think like a lot of the boards kind of have ceased elective surgery, but I think there was a lot of concern that was because it's routine eye care, whereas actually I think it's mainly due to redeployment and space. They're having to prepare for cases rising. The hospitals are getting more and more stretched. I've got a friend in physio in the hospital was saying the same thing, with kind of COVID patients increasing. So I think a lot of it is actually redeployment there. So that's why they're not able to go ahead. It's the space and the staff there as well.
Absolutely. And again, it's communicating that to our patients, as Frank said yesterday, when we're referring them, to let patients know we're not being kept up to date which clinics are running. I know in Ayrshire and Arran they've stopped a few things, but they're keeping going with the macular stuff. So I think you've just got to be aware that patients might be waiting a bit longer. We're certainly getting a lot more phone calls of people going, oh, when's my pressure check? It's due at the hospital, I'm 6 months over, etc. So we need to kind of manage that and help the NHS in that respect.
Yeah, I think managing patient expectations is probably a duty for us now, in that if someone's getting referred for cataract, for example, that or maybe eye capsulotomy, that might not be an urgent thing for the hospital, and they may park that for a little while, and it may be a year they'll have to wait for a cataract operation. And I think that's, most people take that on the chin now. They understand that the service is under pressure.
Yeah.
Great. Next question to yourself, Frank. Are we still okay to provide shared care services on behalf of the NHS through the latest lockdown?
Well, again, the shared care is considered an essential service. So the basic answer to that is yes, but obviously be safe, make sure that you've got proper infection control measures in place, you're leaving time to decontaminate the room between patients, etc., and you're wearing PPE. So the basic answer to that one is yes.
Yeah.
And we're supporting our colleagues in secondary care. So it's a good example of single system working, where we're supporting each other. And patients, most important of all, is the patients are going to benefit because they're going to get seen, whereas they cannot get seen in the hospital at present. I
think it's a chance for us to prove ourselves as well as localities. We can prove that shared care is working and hopefully take on more of the hospital in the future, considering we're upskilling all the time as optometrists.
Yeah. I think there've been quite a few questions around the kind of shared care, and I think the confusion as to with hospitals, if they're not seeing these patients, then why are they not, and why is it safe for us to still do so? But I think, if we've said before, it's the hospital capacity, it's having the staff, having the space, whereas we have the capacity, we have the space, we have the PPE, so that's why we can still continue with these conditions and, as I say, offer that service to patients.
Yeah, agree. Next question is, what happens if I fail to meet the 20% average GOS, but I have remained open?
I think with the threshold at the moment, it's if a practice doesn't meet it, but they've remained open, then as per the recent PCA, they will be paid for their actual activity. But this is something that the Scottish Government are kind of ongoingly reviewing. They're requesting data. I think Frank kind of deals with the data a lot more as well, kind of gets involved. But it's something that we have mentioned to them, and they are aware. They were looking at activity pre-Christmas, but obviously that has changed a lot. But 20% is still, we can class virtual consultations in that as well. So if you are phoning a patient discussing kind of anything over the phone, that still counts towards your 20% as well. So we're confident people will kind of hit that.
I think the government policy around that was to try and encourage practices to be active so that patients did have access across the country. There was some evidence that some practices were not operating at all. There was no claim activity associated with that, very little. But the bottom line is, and then to answer the question in a wee bit of more detail, is that the government and health boards are monitoring claim activity. And the rule that they've introduced in the recent PCA will be that if you don't make 20% of your normal claim activity based on historical data from last year, and it's an average out over either a 6 or a 3 month period, then the board can make a judgment call and only pay you on claim activity only. And I know that this has been monitored, and these reports are coming to NHS boards now. So just to encourage folk to try and make their 20% and they get their average claims going forward. Yeah.
I think it's important to remember to put it through as well. If you're seeing a virtual consultation, sometimes you might think, well, it's just a phone call, I've just reassured them, I've just discussed X, Y, and Z and advised them of drops. You should be putting that through as well as an NHS virtual appointment.
Yeah, I think it's, hopefully, I don't know whether the government will review it again in the current circumstances, because practices are, everyone is experiencing a sudden drop in footfall since I was suffering a lack of football as well, but a drop in footfall since the new year, and we just need to watch that, monitor that, and I know that Optometry Scotland will be in communication with the government should the practice really struggle eventually. But hopefully 20% is doable for most, and we can get on with things just now. But again, we just need to watch this space.
Yeah, I think.
Go back to some of the questions before. We had another query on shared care and why are we doing shared care when the hospitals are cutting back. I think the answer to that question was that all the hospital outpatients, the hospitals are cutting back on elective procedures, but they're not necessarily cutting back in outpatient clinics. So in their defence, the reason that the patients are not getting their outpatient care is because the hospitals are working at less than 50% capacity. So it means that a lot of patients' appointments are getting stretched, and there's an opportunity for us to step into the breach and be the good guys and get these patients seen. And the big area of concern are glaucoma returns. Okay.
Yeah, and I think Dave quickly mentioned yesterday about the claiming percentage. I think we were sitting at 91% of average back in December, but things have changed obviously in January, and we know Julie's involved and Dave's involved in meeting the government weekly. So just to reassure you that we are speaking to the government on a regular basis to bring these concerns up, but we do need to stay open for our public. So it's how you balance that.
Yeah.
And do it safely, which brings me to another question: is what this is from a member. What is happening with the change in PPE provision from what we call the push to the pull system? Could I ask you both to respond to that?
Yeah. I think there's been a bit of confusion what it is, but the push system is what we're in right now. So the easiest way to think about it is that the NHS is pushing the PPE onto us regardless of what we need or what we want. Whereas the pull model is what we'll switch to, where we actually can order, if you need small gloves, you can order small gloves or visors or more aprons, things like that. So that was outlined in the recent PCA. I think they're doing it in kind of 3 phases and they're going to start from the end of January. But another plug for the Scott NHS email, the information is going to be coming to your email address. So yeah, keep an eye on that, because that is going to be happening from the end of January over February and March as well. I think there are some health boards that were going to be different. So NHS Forth Valley, Orkney, Shetland and the Western Isles, they're not going to be moving to the pull model, but they'll have local arrangements in place. So again, NHS email.
And it's a phased approach, isn't it? Some boards are doing it this month, whereas Lanarkshire's doing it next month, and Glasgow will bring it in March. Yeah. And the key thing is, we're talking about NHS mail, the key thing there is that practices have got to have a generic practice-based NHS mailbox, and that would be the mechanism that would be used. So you'll probably get some requests, if you haven't had it already, from your NHS IT lead to set up a practice-based mailbox. And goodness sakes, we've got to monitor it, so look at it every day, see what's coming there, or if inactivity means it gets closed down, and then we'll lose out in the long term.
Yeah, I think one of the things the government mentioned when we were chatting to them, sorry Ali, was that some people are, I think, due to get to the next batch at the end of January, so they might be getting that on the push model, but then a week later might be contacted about the pull model, but that's just the way it is with the spacing. So if you were due to get a push model at the end of January, you'll still be getting that regardless of whether you get then an email the week later about the pull. So, yeah.
And I think a lot of boards, in that transitional period, a lot of boards are making short-term temporary arrangements, and then we should be fine going forward. Alison, anything to add to that?
Yeah, we just had a question through from a member that relates to PPE, so we might as well ask it just now. It says, I have information and practices who are using NHS PPE for private work, i.e. dispensing and contact lenses. Who should we contact? Because this is inappropriate use of NHS resources. There has been many mentions of this in PCAs. So, yep, good point. We never mentioned it. Obviously, you should have your own private PPE for dispensing and contact lenses, but who do we contact if we think there's misuse?
That's a whistleblowing scenario, isn't it? Yeah, the optometric advisor, or I would imagine, would be the first protocol for that.
So local
optometric reach out to the practice too, that just to me as well, that they should know. Depends if you're working in the practice as well, but it might be, depends what it is, because sometimes you get misinterpretation of information as well. So I don't know the scenario that this has been, but I think if you know the practice, then you can reach out to them and say, do you actually know this? And then if not, as I say, your local optometric advisors as well is probably the best. It might be that some of them are doing clinical, if you've got a practice that have staff that are doing fields, for example, and photos, then they're in NHS PPE for that as well. So it's maybe that they've started it, but no, you should definitely have private for all contact lenses and dispensing as well.
Yeah, good.
And bear in mind that some of the stuff that you use is the visors and masks are there for a session. So within that session, you may be doing a bit of dispensing or contact lens work. So that would be a legitimate use. But you're right, probably a wee bit of local resolution would be the simplest solution, the simplest answer there. And if there is a need to escalate, then share it with your optometric advisor, and they will make an intervention.
Great, thanks for that. Next question is, what grants, if any, are available to practice owners at the moment?
I don't know if there's any additional new grant activity. There was an announcement about grant support for retail businesses just recently, but my understanding is that is for practices or businesses, I beg your pardon, that have been closed and unable to function, and they can apply for that grant support. Right now, I understand that there's still ongoing rates relief for businesses just now. but there may be other opportunities in a local sense. I think you know of an example in Ayrshire, Ali, where people can apply for local regional grants to help support their businesses. But I don't know whether some of that is for startup or whether it's for existing businesses.
Yeah, there was something out from the NHS Grampian, sorry, that we had that was to do with like modification of practices and stuff as well. So there's various things out there. Sorry, Ali, I interrupted you again.
No, I would say contact your local council economic development team. These guys tend to know. For example, South Ayrshire, we've got shopfront grants going at the moment to try and boost the high streets, the dying high streets. But there's also grants to take on new staff members, etc., because they're trying to encourage growth in business. So yeah, definitely look at local level for that one.
Yeah.
I think there was something recent about insurance as well that's come through. I saw that in the news yesterday, but I don't know the full ins and outs. Insurance providers and COVID, I think, but not sure. Really want to look in.
Yes, we'll be watching that carefully.
Yeah.
Keep your eyes and ears peeled and look for every opportunity to enhance the practice. Now, I've got a little question for everyone. If track and trace identify I have been in contact with a positive case and have to isolate, what are my legal entitlements for financial support? Another tricky one, and I'm glad I don't have to answer that because I've asked the question.
I might, did you jump in and ask that first? That is a tricky one. I think from what I believe from Test and Protect, they will contact you if there is, if there is a contact for a start. I think it's important to know when the contact was. In a work environment, they've said NHS workers or people wearing kind of NHS PPE, they shouldn't have their phone, like their Bluetooth switched on whilst they're in work anyway, because they're not deemed a contact. So I think it would be important to try and work out, was it actually from work? Was it your handbag with your phone in it next to the patients, or was it actually from somebody out with work to start with? But I know when they do contact you, they ask, if you're going to have to self-isolate, are you going to be financially implicated? So they do mention that on the call. So I think go from there.
Yeah, I think if the contact is in practice, you're probably safe from it all. It's the external contacts when you've maybe met someone elsewhere, and then it gets a bit complicated. But the advice is there from the track and trace teams. Alice, have you any experience of this in practice or anything?
Yes, we had a staff member test positive last week actually, and as long as you're following your standard operating procedure that we set out right at the start, I have to say Test and Protect were brilliant. They got in contact with us, and initially they'd said all staff members that were in on the day had to isolate, but remember, these guys are just manning the phones. They could be nurses, they could be just members of the public that are not trained to our level of PPE. So it actually got escalated to the team leader, who then phoned me as the employer and said, look, I want to go through your standard operating procedure, speak to your staff, were they having lunch together, were they doing this, were they sharing phones? And everything was no, and they said, right, we can de-escalate these cases of the staff member that was isolating. So it was only one staff member that had to isolate for 10 days, but be really, really strict on the staff and where they're coming into contact. And they said the biggest one's lunches, but everything else, keep it as tight as you can. And also remember to contact your board, because the 20% thing won't come in if you're having to isolate. You might have Optoms down. There's got to be reasons for that. So make sure you contact the board.
Yeah. I think, as you say, Ali, it's being careful that the staff are being vigilant, and you see it on the shop floor. Everyone's vigilant, like cleaning down keyboards or phones that they've been using. But then I think it's then that break for lunch is making sure that everyone is wiping down everything else as well. And then that would be when people are a little bit more relaxed feeling naturally. So it's just making sure everyone's being safe there. But we had a similar experience and they were brilliant. They just talked us through, tell us about your cleaning procedures, what have you got in practice, what measures are you taking, what training has the staff had, and they were happy with that, so as long as, I think it's just showing that we are following the guidelines.
Yeah.
Yeah, I think that works. Yeah. My experience was our Saturday girl who was at school got infected, and it's when she was at school, and So she hadn't been into practice, so she just took her 2 weeks off, and again, it was just the track and trace were really helpful in that scenario.
Yeah. So I've got a question then on to kind of safety and going forward as well. So when will front staff be offered the COVID vaccine?
Yeah, well, this is everybody knows the vaccination program is in place. As far as optometry staff are concerned, I think some NHS boards have been more alert to it than others. Than in Glasgow, but the two that I work in, Glasgow and Clyde and Lanarkshire, have been very proactive in offering vaccination to optometrists and other frontline staff. I think that the simple question that's asked is, what makes you a key worker? And the key worker is someone who's working in an optometry practice who is working within close proximity of patients. So anyone who's working within 2 meters of patients on a regular basis would be considered a key worker, and they should be sent for vaccination. I think that's the bottom line. So that would be receptionists, dispensing opticians, optometric advisors, and optometrists are the 4 obvious groups that I can think of. And as I say, just be aware and alert for the opportunities, because in Glasgow they're doing it they're releasing slots in batches, and they're doing much the same in Lanarkshire. I don't know if it's any different in Ayrshire and Arran or Grampian, but I know that some boards like Tayside were a bit late to the party, but they're now totally switched on and vaccinating key workers, including optometrists, optometry practices, pharmacists and dentists, where they were a wee bit slow to do it earlier. Is there a different experience in Grampian and in Ayrshire?
No, we were vaccinated before Christmas, but I think it's, again, NHS email, because we were switched on, we got it, and a lot of practices in Ayrshire didn't check their NHS email, didn't even realise that we could get vaccinated. So again, get on that, and again, be patient a wee bit, because I've got friends that are working in the COVID ward, and I've had it a month before them. It seems a wee bit unfair, but it depends how your optometric advisors / managers are dealing with it. So be patient, but we're getting there.
I'd be surprised if I got an email in December offering me the vaccine anyway. That was quick. They're just going through the alphabet. Maybe that's what it is. Yeah, no, Grampian, we've started vaccinating. So I think from what I've seen, it's kind of practice by practice seem to be contacted. It's great to see on Facebook people changing their status to I'm vaccinated. It just seems to be a practice at a time is popping up on my feed. So it's no, it's really positive to see. It's great that everyone's getting included, certainly, because we're all kind of on frontline working, at risk. So it's good that they're going forward.
I think compared to down south, we've really done well to get this out to ourselves.
Yeah, it's really good.
And the next question is related to vaccines as well. What should we do if a member of staff declines the COVID vaccination?
I think there'll be a lot of advice kind of on like ACAS for this. ACAS is, if you haven't used it, is a brilliant website, and you can phone up as well. It's free, but they're good for offering kind of advice and kind of employee advice and things. But certainly we should be supporting staff. There's a consent kind of element around the vaccination. So, it's something we can't force staff to get this vaccination. It's for their health and safety. But if they also don't want to do it, then it's kind of just supporting them in that decision, making sure they're aware of all the facts and why they don't want to go ahead. But yeah, we certainly can't force them.
I think it's got to be understanding and respectful of a person's decision. The evidence, the clear evidence, is that vaccination works and it's relatively safe, but we probably won't know that until millions and millions of people have been vaccinated. But again, it's an individual's choice, and most feel safer taking the vaccine. It's what do you do with the individual in the practice? And every practice, I've got a couple of folk that are reluctant to get it. One that was pregnant, I can understand why. The other one is not. But do we try and find a different role in the practice, which is less patient-facing and less in contact with others, maybe more office duty? In a big practice, it's probably easy to do that, but in a one-man practice, it would be very, very challenging. So as we just need to look at each scenario on its own, take the advice from ACAS and others, or from your own employment law folk, and make sure, one, that everyone, they look at it as a system and make sure that everybody in the practice is as safe as they can be, and work around that individual. And talking about lunches, clearly no lunches together, so you try and keep the PPE on all the time and keep a distance at all times. That is a really tricky one. That really is a tricky one, and I'm sure we'll hear a couple of issues around that in the near future.
I've got a very quick one, so I know it's been covered quite a few times, but what category of key worker do we fall into, as optometrists or as kind of front staff?
Yeah, I've seen a bit of chat on social media, etc. about this, and I think it's fairly simple. Optometrists are classed as category 2 key workers, and all practice staff are category 3 key workers. Remember, local authorities are responsible for deciding on applications made to them for children, so you're not automatically guaranteed a place. So you're optometrist category 2, front of house staff category 3, apply to your local council and take it from there.
Perfect.
Yeah, in my neck of the woods, it's the 2 parents that have got to be key workers to get access to childcare. It may be different in other authorities. So that, again, look at the rules and get a good understanding of it, not just maybe one, because if somebody else can be there to look after the child, then they might the facilities might not be available. Now, I've got another question. Again, it is one where we need to demonstrate compassion and sensitivity. I'm from a BAME community and have asthma, so cannot wear a mask. What are my employment options, and can I ask to be furloughed? Both of you.
Well, I'm happy to pick this one up. I think, if you do fall into that category, then obviously you should advise your employer if you're exempt. So, if it's due to an underlying kind of health condition, and if you do fall into that category, you can request an exemption card for it as well. Unfortunately, you can request to be furloughed, but it's up to the employer. They don't have any obligation to furlough you, but you may be entitled to kind of statutory sick pay if you have been advised to shield. So that is something. So if you are worried about it, you can contact your GP to advise and see if you should be shielding.
Alistair?
Yep, just again what Julie said, and I think we'll post these questions on Optometry Scotland website, so we've got numbers, like, for example, if you want an exemption card, etc. If I read them out on here, you won't have time to write it down, but we'll post all that kind of stuff up so that you guys can follow up on it.
I think it's definitely folk from the BAME community are significantly more at risk, and we really need to try and do what we can to protect our team members at all times, regardless. And I'm sure everybody will be sensitive to that point. Another question is, if I am off work sick from COVID, am I entitled to statutory sick pay? Julie? Yeah,
of course. Yeah, if you haven't exhausted what you normally get, well, if you haven't exhausted the kind of SSP entitlement, then yes, you can do that. So yeah, you would be entitled to it still. Nice quick one.
So we've finished on main questions. We're going to go on to answer some of the questions that you guys have sent in, and then we'll go back to some other questions if we've got time. So the first one's a wee bit more light-hearted. Someone's asking, any tips for stopping the trial frame steaming up?
I know there's been a lot of discussion we've had with our optoms that are saying you can get heated mats like on Amazon. So those little heated mats underneath your trial frame keeps them nice and warm, and hopefully less.
They're for gardeners, I think, for seeds. So the wee heated mats that you plug in, yeah, it really works. We've been keeping our volt lens on top of the radiator and keeping it in your pocket, keep it warm so that it doesn't go cold and the thing condenses. And by the way, this is Julie kidding on that she's in a test room.
I'm not. On a Friday morning, I speak to all my optoms, and they tell me these stories. Because all sharing the hints and tips. And you definitely can't keep all your trial frame lenses in your pocket. So volt lens in your pocket, trial frame heated, trial lenses heated.
I think as well, keeping them clean definitely helps. I've been spraying mines and keeping them as clean as you can. It just stops that condensing, but it's not easy. It is not easy. And I've had a few wrong refractions, I have to admit, over the past few months because of it. And it's just one of these things. There's no fix for it. Frank, you get any tips or tricks?
I don't use a trial frame very often. I've got a phoropter, but yeah, the same idea is in the morning when I come in with my Volk lenses, I just give them a wee rinse through with the frame heater, and then I picked up that wee tip about keeping the lens in my pocket now and again, to try and stop it steaming up. It is a real frustration. Stopping and taking it away and cleaning it, but you just got to do what you can. You've got also, then if it becomes impossible, you can maybe get the mask removed a little bit below the nose. That's not ideal, but if you've got the plastic screens there, then hopefully you're protected. Again, it's all a wee bit of management. There's no perfect answer for this. I've tried the sprays on the lens. The sprays work fine on plastic lenses, but they don't seem to work on glass lenses so well.
Yeah, again, it's risk versus reward. There's been the odd triage came in and I can't get a vision and it's missing up, and I'm thinking this could be something serious here. So I've got to risk that contact by asking the patient to move their mask down. But I feel it's a clinical judgment. Or if you don't think it's that important routine, you can get them back in a month or two when hopefully things are improving. Good. Got another question here. If you have already raised to your employer or line manager that patients are not being triaged and far too many risk patients who are getting recall letters for asymptomatic routine tests are being booked, where should we turn next?
I think we could have covered that already. I think it would be to go to either your insurance providers. You know, they all offer impartial advice, and they also, if it is a company paid insurance as well. You know, a lot of people get quite nervous about that, but they put up a Chinese wall. You know, it's something. If there was something that you were wanting to speak to someone about your employer and you were worried because your employer plays in insurance, like I get how that can feel kind of uneasy, but no, these companies, that's what they're there for. They are giving you professional kind of advice, and they will kind of talk you through what to do in that kind of situation. And they wouldn't reach out to your employer and say, so and so phoned me yesterday. That's Frank on the phone moaning again.
As always, Wells. But I think common sense maybe prevails. I think we touched on it earlier. A wee bit of articulate your concerns with your colleagues, and it may be that a solution could be found internally that suits everyone. And again, there are Optometry Scotland is there as an advice resource, as we're doing just now. There's optometric advisors or local board contacts that you could speak to anonymously or in person, but seek advice. But the issue is that you are safe, that practice is operating safely, and that the patients are safe, and that should be the overriding factors in all of this. And if you can be sure of that, then everything is okay. If not, then you maybe need to escalate it to someone else.
Yeah. Great. Next question is.
Oh, you're going. Go for it.
Sorry. I was just going to say, what exactly is meant by triage? If we're able to see routine patients, what else should we be asking them now that we weren't before Christmas, if anything?
Probably the same.
Yeah.
Okay. Julie, on you go.
Well, I was going to say, before Christmas, I don't know, everyone's probably different, but they were maybe a bit more relaxed about what they were triaging. You know, I think we've always been doing the kind of COVID, certainly in our practice, we've always been doing the COVID questionnaire, you know, asking if they've got any temperature, fever. You know, you should still be asking these kind of questions. Have they tested positive for COVID recently? You know, all these kind of things. So I think on top of that, it would just be, triaging as normal, finding out kind of the reason as to what they're coming in for. Don't know if there's anything.
Yeah, the key thing is, do you really feel you need to care? And if you do, then we'll see you. But if you think you can park it for a month or two, then why don't we park it for a month or two? A lot of it's just plain common sense. And if you have the conversation with the patient or your frontline staff of the conversation, then we could usually cover it off. But there are some people, regardless, who feel they need to be seen, and then you need to see them. Goodness sake, I don't know where it would leave us if someone's looking for an appointment, they've got a retinal detachment and you've missed that in their sort of opinion, regardless of COVID, I think it would leave us a little bit vulnerable. Yeah.
I think, yeah, like you say, it's just checking why do they want to come in? You know, patients themselves, we see it already because the diaries, like you say at the beginning, you know, the appointments are kind of fairly gone down. You know, we've got a lot less appointments coming in than we were seeing kind of prior to Christmas. So patients are kind of deciding themselves naturally anyway whether they should be coming in or not. So these people that are phoning, they know there's a pandemic, they know it's lockdown. So why are they contacting us for an appointment? I think it's trying to ascertain, is there an underlying reason they're phoning, or actually, you know, can it wait? And if they know, you know, there's non-essential travel, then, you know, why do you want to come in and see us today? And how are you getting in to see us? You know, are you getting the bus, or it's kind of things like that. I suppose it's.
Yeah, communication's the key. Communication's the key here to make sure that they need to be seen. I think one of the examples I think I've had is we've got to remember there's different reasons people need an eye test or think they need an eye test. And I had one person that was really anxious about, they were due and it was fairly routine, but they were so anxious they were sitting at home worried because they hadn't had their eye check, and they're feeling the same with dentistry and routine, etc. But we were able to see them. They said, look, that makes me much happier that I can sit at home now, I've had my eyes checked. So there's different reasons. It's using professional judgment.
Yeah.
Excellent. So next question was, who do we contact if we didn't receive our last PPE delivery?
Your local health board. Yeah.
Yeah, health board optometry advisor would point you in the right direction. That's a simple one.
Yeah. Likewise, if you're running low on something specific that you need, you know, you can contact them if you feel that you're really struggling, or likewise work with each other in other practices to see, is anyone, could you swap some large gloves for some small ones, you know, things like that. But no, you can contact your local health board and they can arrange for extras if need be.
But I think the central push is coming again in round about the 25th of January, so there should be at least one more push supplied to all practices based on their activity. So that should come out and hopefully see people through to when they're in a position to do the pool. In Glasgow, obviously there'll be another 2 or 3 pushes, and in Lanarkshire maybe another one after that. But the rest of the places the rest of the board areas should be set up for pulling in kit as and when they need it.
Yep. So next question is, someone's asking about the track and trace question. They think it was actually aimed more about whether grants were available if you have to close your business due to having to isolate. So I think, remember, if you have to isolate, contact your board and the 20% thing goes away and you get your average cost. That's the first thing. If you're closed, I don't know, it depends obviously how long you're closed, if you're available to claim any other grants from the government. I'm not quite sure about that, but average should certainly help things.
And there was that, as I said before earlier in the chat, about the change to insurance. So I'm not sure, we need to, like, that's obviously just been announced, so I think we need to look into that a bit more and actually see what we can get from that. But likewise, when Test and Protect phone you, they do ask, you know, are you going to be financially affected by this? So I don't know if you say yes, then what that then leads up to as well, but they certainly do take that into account.
Great.
I think the business's accountant will probably be available soon to answer some of these queries around claims for insurance. And again, it may be another wee bit of protection people could bring in to their practices. There was a question that the folk asked on, I think it was yesterday, and is it relating to diabetic retinal screening? What's happening with diabetic retinal screening, and why are optometry not involved in helping them catch up? And I think it's to do with the change in system. They're changing the system to something called Optimise. But I thought you may have a wee hand on this, Alistair.
Yeah.
That's coming from the air and where there is
optometry. Yeah, so in Ayrshire optometrists do the retinal screening, and we are helping. We're the only board that does that, I believe. There was a bit of an issue with Optimise, and it had obviously paused between March and October. So the DRS have moved to this new system, but to get round it, they're moving anyone who has had 2 visits and have had R0, which is the lowest amount of no retinopathy, for 2 previous visits. They're moving them to a 2-year recall. So if anyone contacts you asking, they are moving you to 2-year recall for that, and they're concentrating on new diabetics and people with retinopathy. So the only problem is they're not telling the patients that. So the patient's getting to a year saying, oh, I've not had my diabetic check. Get them to contact the local screening service.
Yeah,
I think the original
diabetes. That's one of the shared care conditions that we've been kind of monitoring.
Yeah, maybe that will come to the shared care initiatives. But I think it relates back to the original sign guidance for diabetic retinopathy screening, which was carried out. The sign guidance was published about 10, 15 years ago, and even at that stage, there was a lot of evidence. I served on this question that the need for diabetic screening probably kicks in after about 5 years post-diagnosis of diabetes. So they're just maybe go back to that evidence base now, which hopefully will still be safe for patients.
Yeah. Very quickly, one last question we've had in. So someone's asking, so if we are triaging to ask reason for visit and they say routine or no symptoms, does this mean we can't or shouldn't see them? It's becoming the same as emergency or essential then? And I think this has always been the chat recently, hasn't it?
Yeah, I think it's difficult. I mean, if it's routine, if they were due yesterday and they're, I don't know, 20, no prescription, never had any problems, then why are we encouraging these people to travel? I think the whole part of it is that they don't want people out and about in cars, they're on public transport. If they come in for an eye test, they also nip in for a coffee, or they, it's out and about. It's trying to get less people on the roads and things as well. So, I think you have to weigh up what's the reason. Are they a risk factor? How overdue are they? Are they a year overdue, and they're falling into condition? What was their eye test like last time they were in? Was there the beginnings of dry AMD? They don't have symptoms, but you're thinking, well, they're quite overdue now. I think it's just, these kind of ones become more difficult. I think you need to be looking at past records and
it'll be very hard to change legislation to just make it. They've got to have routine in there because there's no other way around it, if that makes sense.
Yeah, there was quite a lot of chat about it, and I think by not having routine as well, if you just say essential, then what does that then mean? Because essential last time round was essential like in the next 4 weeks, whereas now we're talking, patients are really overdue now. There's a backlog of kind of routine appointments coming through and we pick up stuff in routine appointments as well. It's not just a case of everyone comes in and tickets all healthy, no problems at all. And as much as we'd love to say it's January, who knows what's going to happen after that, and there'll be a backlog again. So I think that's something to still be seen as kind of patients.
It's a new challenge for us. We've been placed in a difficult scenario because of the lockdown versus availability of NHS services, and we just need to try and do the best we can to manage the scenario.
Yeah,
and if we can step up to the plate and help the government, it's not going to do us any harm going forward with negotiations, etc.
Yeah.
So
perfect.
Very.
Well, we've got one more question.
Yeah, well, no, it was more of a comment. One of our OS team, Colette Dunsmore, has got in touch about the grants, and she's checked, and opticians are not allowed any money. That's basically all she said. So because we get the average, we're not going to get anything else extra on top of that if we're closed due to a contact.
So I think we stay close to the insurance thing and see.
Yeah. We have got more questions that we have answered. We'll publish them on the OS website so that you guys can kind of read through it on your own time and get numbers, emails, who to contact if you need your NHS email unlocked, etc. But Julie's going to do a wee quick presentation at the end on behalf of OS.
Yeah, I'm just going to go through this for you. So obviously we're working kind of closely with the government, like Alistair said. We're now meeting every 2 weeks to go through this. So our main objective is obviously to get us through this pandemic and continue with kind of that support there as well. But we're still kind of, our main overall objective is to increase the GOS fees by 3% in line with kind of health spending. So I think like what can you guys do really to help us? So if you're not a member already, join us. We do have different options available if you're a practice or whether you are an individual as well. If you're an individual practice and you want to kind of have an MSP visit, we can support you with that as well. And we do have access to a PR company too, so we can get information through that. Or likewise, just reaching out to us if you've got any questions. We're happy to help. members reach out to us all the time. You know, we do have regular conversations with the college, you know, the insurance, photo, AOP, you know, so with GOC, so we can reach out to any of these guys if you do have any questions as well. So that, just a kind of reminder for people, because I think a lot of people maybe don't realise this, but if you're part of one of these bigger organisations, you're actually already a member. So you've got a representative in Black & Zars, Boots, Duncan & Todd, Vision Express and Specsavers. So if you would like to join our mailing list, you know, you are a member, contact us at TELOS through our website, and you can be added to the mailing list to get the information sent out. So it was just to let you know that actually you are already a member. So if you've got any more questions, you know, thanks, we realise we're quite tight on time now. So if you do have any questions, or if you've got any feedback on today's webinars, you know, obviously come and have a chat. Emma, Joanne and Nikki, they're going to be in the virtual exhibition Zoom room kind of all day, and there's different times available. So if you want to kind of pop in and see them, or likewise, if you want to just reach out by email, you can do. And here's a little QR code for our website, and that's us. So thank you very much, everyone, for today, and thank you to my Alistair and Frank. And obviously, I'm not testing, so you know, you guys are keeping me real. So thanks very much, and hope you have a good. Everyone enjoys your day and all the different courses that are available. It's really interesting. So yeah, thank you. Thanks for your time.
Brilliant, folks. Nice to see you. And if you need anything, just get in touch. Remember, that's what we're here for.
Here to support you. Bye now.
Thanks. Bye.
Bye.